In 1996, 8 September was designated as World Physiotherapy Day. The day marks the global physiotherapy community. It is an opportunity to recognize the work that physiotherapists do for their patients and community. Welcome to another episode on Health is Wealth. My name is Fatima Rufai Musa and I remain your host. Like always, every week we have a guest in the studio where we discuss about pressing health-related issues that disturbs our community. And like always, this week also, we also have a guest and we are also marking the day as World Physiotherapy Day, which the focus on this year is on lower back pain. And we have a doctor in the studio where he will be educating us more, telling us what physiotherapy is, telling us what back pain is, what is the relationship between back pain and physiotherapy. And this doctor, we can say, is Dr. Abdul Mumin Haruna. He's a HOD of physiotherapy at UMC and Sir Muhammad Sunusi Hospital, and also CEO at AZ Physiotherapy Clinic. Doctor, welcome to our humble program.
Jazara, thank you very much.
You're welcome.
Our audience, Assalamu alaikum.
Like I said earlier on, today we'll be we are marking the day as World Physiotherapy Day. We are celebrating with both doctors and patients who undergo this treatment. So in honor of that, before we even dive into the discussion, I would love to know, and I'm sure both our viewers and listeners would love to know, what is even physiotherapy? Because before even diving into the discussion, what is physiotherapy?
So actually, so many people, they really don't know much about physiotherapy. But physiotherapy simply is a branch of medicine, like any other medical field, that deals with assessing your patient to prevent or to diagnose, see if you can prevent or treat and or rehabilitate a disease or an ailment that affect that through physical means. And these physical means actually are something non-invasive, non-surgery medicine, even though sometimes we recommend medications, but we're talking about physical means, that physical stimuli, like water. Normally we call it hydrotherapy, like electricity, that is electrotherapy, or giving exercise, prescription of exercise therapy, or using ice, that's cryotherapy, or sometimes we use heat, that is thermotherapy. And we can use bare hands, as in manual therapy or massage or some other facial relief and other things like that. So basically this in brief, actually that's physiotherapy.
Okay, you mentioned things like using light, using water, exercise, and all those things. So what is the use of physiotherapy?
The use of physiotherapy, actually, physiotherapy is moving towards finding any disability, address it, and then see what causes it, and then how can we assist patients back to normal activities. If there's, for instance, any pain, how can you we relieve that pain to make you move back to normal activities and improve your qualities of daily life, living things, living quality of life.
I know most of the time they say physiotherapy, maybe you undergo, maybe you have a certain condition, that's why you go through all that. Are there specific illnesses that requires this physiotherapy?
Actually, always think of physiotherapy whenever if you have an injury. Or if you have any disability that I'm unable to do this, or I'm having pain this, or whenever you're having problem with muscle, bone, ligament, or joint, or nerves, just think of physiotherapy.
So what is the main role of this therapy session?
The therapy sessions, the main role is that as I said earlier, to restore back to your normal functional activities. For instance, now, before we are able to walk from here to so many distance, but now you cannot do that. So physiotherapy will help you in restoring back to that functioning.
That's
Or
functioning.
maybe somebody is fit, but now he's having a back pain. As now that's what you're discussing about.
Okay.
So how can you relieve that back? Maybe if you sit for maybe an hour, you start having pain and things like that. Then
Okay.
really that's an issue. So
Okay.
physiotherapy is there to solve your problem, inshallah.
Okay. So for people who have injuries, for instance, maybe someone just fell down, does he have to go through, does he need a doctor's requirement, referral to meet a physiotherapist, or just directly he can just go meet a physiotherapist and tell him his condition?
Actually, it's not necessary to seek referral in order to see physiotherapist. We physiotherapists have a direct contact approach. You can meet a physiotherapist directly. We even prefer to meet physiotherapy first before going to any other physician, because sometimes when you meet physicians, they may think sometimes outside the box. But always, as physiotherapists, when we come, we are dealing with neuromusculoskeletal issues. We know that in detail. But they start maybe doing some other investigation, do this, do that. So before that, you wasted money, you wasted time, and things like that. Actually, no, it's not you wasting, but mostly, if you come to physiotherapy first, we'll assess you first. If he find out the diagnosis, whenever he find there's something called yellow flag or red flag, then we'll take action immediately, whether to refer you to appropriate discipline or to hold you and treat you as a physiotherapy patient.
So if I'm understanding all what you're saying is that when you meet a physiotherapist, he knows more about the entire body movement and everything. So he has more idea on every issue you have on your body.
That's exactly the point.
Other than the doctor. A doctor might just prescribe a medicine
to you. The doctor actually is not that doesn't have the idea, he has an idea.
He has an idea?
But the issue is that he delved more into different other activities. Not only that musculoskeletal issues.
So the motto for this year is
low back pain.
Low back pain.
It's true.
So being the fact that that's the motto for this year, so what's the relationship between physiotherapy and lower back pain when it comes to treatment?
When it comes to treatment, actually physiotherapy plays a significant role in managing right from the prevention first. Has a vital role in trying to assess, find what is exactly the cause of that problem. If it's not directly the problem, then how to prevent it. Maybe some people now, I imagine now somebody is just walking, he's carrying a bag, maybe one is a backpack, but he's carrying the bag on one side. As a physiotherapist, when you look at him, you say, my friend, this is the way you just render some advice and educate him on how to carry. Even the weight of the bag may be detrimental to his health. That's one. And then right from there, prevention, and if it moves to the treatment, then fine. Now we are on this stage. What you need is treatment. So physiotherapy is there to render that service for you. And if beyond that, moving to rehabilitation, still physiotherapy is there for you.
So pregnancy with back pain. There are a lot of women that when they are pregnant, you find out that maybe they have excessive back pain. And then some of these women, even when they give birth, I don't know, some of them, like people living in the rural area, even though things are changing now, they do go to the hospital to give birth, but most of them, they give birth at home. Do you think giving birth at home can also lead to that back pain not going away and still being there, even when while they were having that back pain during pregnancy, and even after that, after giving birth, without them maybe going to the hospital or anything for checkup and all?
Actually, to start from your last question, that whether giving birth at home can lead to low back pain, actually the answer is no. Not give. Because precisely what is giving back pain in women is like two issues. Number one, there is change in the posture of their due to the increase in that abdominal weight they are carrying.
True.
Because of the womb, they are carrying the baby. So that will displace the center of gravity of their body. So that will give so much stress to the back. That's the reason why always is good when you are having antenatal clinic, it's good if you went to the place that they have a physiotherapist or people that know very good about physiotherapy, that will be showing them so much of exercise that they should be doing during antenatal. In that case, not only exercise, but even some other ergonomics modifications. Like for instance, now, how can you sit? How can you do this? How can you do some other activities while you are pregnant? So that will help a lot. And secondly, what is happening is that there is some other hormonal influences that comes that especially during the third trimester, that lead to there's some hormones called relaxin and progesterone. So these hormones actually they have effect on the joint.
Okay.
And if you remember, I mentioned that low back pain is not a diagnosis, but it's a symptoms.
True.
So there's so many other causes that lead to that low back pain.
You can only just feel the pain.
Yes, that in that case probably may arise from the sacroiliac joint dysfunction, which is most common, happens in the women during this pregnancy or after delivery.
Okay.
So these two may be the cause of that they haven't that.
At what point does one need a therapist when they are having back pain? You can, these days, you can find someone that has been having back pain for like years. You tell you, it's so funny. When some, they are not even old. They are not old, but like they still have that back pain. And we have this thing in us, we Nigerians, that when we are going through something, we hardly go to a doctor. We just do self-medication, take anything traditional, or do say just rub in your back or anything, dip it or something that would just calm that now.
So actually, whenever you are having a pain or injury, it's good to meet your doctor of physiotherapy.
Okay.
Because when you meet him, sometimes it's not only the physical treatment that will give you.
Okay.
There's something called cognitive behavioral therapy, as you're saying now. It's also part of it. Like, let me just debate a bit in order to give us more highlight about what this CBT means. Like, for instance, now, during olden days, people may have a stroke, but they are not recognizing stroke as a medical condition. They are recognizing stroke as is maybe just like issues with the maybe supernatural power, or maybe it's mostly in house I say in something like that. So maybe just like charm somebody that do something juju or something like that. So in order to treat your patient, firstly you have to educate the patient first on what exactly causes of that problem. When he realizes that this is a medical condition, then he's ready to embrace what you are going to dash in to have a better treatment. So in that case, actually, whenever you're having any injury, whether it's an acute or subacute or a chronic, you need to see a physiotherapist. This, you can understand this is an acute when it happens within the first 6 weeks.
Okay.
You have the pain and it lasts within these 6 weeks. That is an acute low back pain. But when it is more than 6 weeks, but it's less than 12 weeks, then it's subacute low back pain. But when it's more than 12 weeks, you are suffering with this low back pain, then it's chronic low back pain.
Okay.
So in any of this stage, you need to see physiotherapist, and actually it gives so much help to see that you back to normal activity.
Okay, for like sleep, I'm sure there are sleeping positions or sitting positions that when you do the courses.
Yeah, actually, as I said on the courses, bad posture is one of the major causes also of the back pain, or one of the major high risk factor of the low back pain. So basically, if we look at how God Almighty created our spine, it's not straight. is in normal S shape.
Okay.
Our cervical spine is moving inside, we call it lordosis,
Okay.
and the thoracic region, that's the chest region, is moving outwards, that is
Okay.
kyphosis, while the back lobar or the back lumbar region is also going inside, that is
Okay.
lordosis also. But whenever, if you are sitting for long, you are posting your spine into straight position, and that will burden your spine more.
Okay.
That's why, like for instance, now if you're lying down, if the pressure or the tension on your spine is 0, if you stand, you multiply 3 times.
Okay.
But if you sit down, you multiply it 11 times. So sitting is more stressful to your spine than standing. And then standing also is more stressful than as you are walking or when you are lying down.
You shouldn't just stand for too long. You
so
should just
all this, it's showing you how posture is so significant as a cause of your back pain. Like for instance, now some people have bad habit of when they're sitting, they will not just sit normally, they'll sit like this.
True.
I'm sorry. Just demonstration. Some people sit like this. While some people, you see, they sit like this. Some people just like this. And
So
all
they are
this
stressing the back.
posture, they are stressing the back. They are bad postures. And some people, when they are lying down, they do not just lie as normal way in to make the good alignment of the spine. They may either use pillow to be higher pillow or lower pillow, or maybe even they even lie down straight. I will demonstrate how the proper posture are in order for more.
I think we should give our viewers time to like watch this short clip we made, where you will see how this position, causes back pain, and what exercise you are supposed to do to like stop the back pain or reduce the pain you are feeling. And our listeners also can comprehend what is going on by listening to all the positions that are being done. We'll be back after this short break.
As I was saying earlier, that the best sleeping position is that lie down on your side. You can either lie on your left or right, you don't have any problem with that. But most people, they wrongly sleep straight. If you sleep like that, then your back muscles are not resting at all, and that will lead to the continual back pain. Okay, so the best way is that if you want to lie on the side, then at least bend your knee, but not necessarily too much, just mild bend, and then also mild hip bending. Like this, your back muscles will be relaxing. And another issue is that even if you need to be more comfortable, then you can get a small pillow and then put it in between your knees to lie down like this. So that will be the best sleeping position for low back pain. And another issue is that some people, they like to lie down on their back. Like for instance now, lie straight on your back. This is the same thing also, your back muscles are not resting, and this will increase your pressure to your back muscles. So in that case, if you want to relieve the pressure, you can bend your knees slightly and then put small pillow in between like this. So like this also, your back muscles will be relaxing. And thirdly, some people, they like to lie down on their stomach, but actually the best thing is that try to avoid sleeping on your stomach. But at least even if you want to do that, then don't use pillow on your head, but you can use the pillow under your waist like this. But the best thing is don't lie on your stomach, because when you lie on your stomach, there's increase in your abdominal pressure, and increase in the abdominal pressure lead to the increase in the intrathecal pressure, which will increase more pressure to the nerves that are affecting your low back. Okay, and then how can you use pillow? Which pillow or which mattress is the best? As I was saying earlier, the mattress that would be the best is orthopedic mattress or semi-orthopedic mattress. At least it should be firm. That will be the best. Don't use on soft mattress. Sleeping on soft mattress will normally increase low chances or increase the condition of low back pain. If you are lying on a pillow make sure that the pillow is not too high and it's not too low, because when it's too high, it will make your neck to be a little bit tilted upward, putting so much tension on the muscles of your neck, and the same on muscles of your back. Likewise, if you are sleeping on too so low pillow, it will make also the neck to be tilting downward. That will also affect your neck and your spine in general. And then the best pillow to get is recoil pillow, that when you press it, it will go down, and when you lift it, then it will immediately regain its shape. That will be the best pillow to use. And then the next thing is that regarding how to perform your activities. Most of the common activities like teething or brushing our teeth or dressing and other things like that. Some people, they are really surprised that how just to brush my teeth is only 5 minutes or less than 5 minutes, then how can it lead to fresh on that? But yes, actually there is, because if you take the weight of a head, it's more than 10 kilograms. So most people, they are just bending like this and brush their teeth, which is wrong. So at least if here is the wash hand basin, then put your hand on the wall and then brush your teeth like this. That will be the appropriate way to do it. And the same thing if you are dressing, don't just dress in standing, maybe putting on trouser or skirt or any other things like that. Just sit down. So you will say, this is lazy, but it's not lazy. Health is wealth, right? Okay, that's very good. So always is very good proverb actually. So just take your time, sit down, and then dress, whether it's putting on socks or shoes or trousers or whatsoever the dress it is. That will be the best. And another issue is that while people are performing activities of maybe washing laundry and things like that, some people also prefer to bend and wash their clothes. That's also very wrong. They should sit and then wash the clothes when you do exercise. But remember, always, this is not serving as your treatment. Always remember that whenever you are having low back pain, try to consult your doctor of physiotherapy, because always try to have guided to be what is exactly wrong with you before you start doing your own home programs. But at least this will help you on how you perform, if you are having, how you are going to do the exercise while at home. But first thing, try to meet your doctor of physiotherapy to guide you on what to do best, depending on your back pain. As I said earlier, you may have almost, you can have like 10 people all presenting with low back pain, but they have different presentation of the low back pain. So the exercise may vary actually, but some of the common exercises I mentioned, that you have 3 movements that you need, that is stretching exercises, mobilization exercises, and strengthening exercise. And now I'm going to show you some of them. Like for instance, let's start from the stretching exercise. You can do your stretching exercise from individual leg. Like now you can bend this, your right leg, and use your hands, hold it, okay, and then make the other left leg to be straight. In this case, you can have either to count 10 or you hold it for 5 seconds. If you count 10, is the same thing as holding for 5 seconds. Like for instance, now 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you let it go, and then you grab your left leg and also move it towards your chest, and you hold while your right leg is straight. And then you also hold and count 10 count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you let it go. If you remember, or if you can, I'm sure you'll be feeling some stretching while you're doing that. So that's what is neat. It will make your back muscles, low back muscles, to be stretched. Secondly, the next one is to get the 2 legs together, both the 2 knees, and then move them towards your chest at you are comfortable. Some people, maybe they have large belly, also when you press it too much, maybe it'll be discomfort, but at least move it towards the comfortable zone, and then you hold it for 10 count also. And all this, you have to repeat them 10 times, 8 to 10 times for better experience. So now you hold it and you count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remember, this is not second. It's not second count. If you have to use the wristwatch or clock, then you have to hold it for 5 seconds, not 10 seconds, because counting is like double of a second. So, and then when you're bringing back the legs, it's not straight. You have to move in this crook line position. This is called crook line position, because some people, when they take it back straight, they may have some discomfort at the back again. So instead of that, then you move them to crook line position, and then you repeat that also 10 times. You take it back, you hold, and you count 10, and then you bring them back. That is another count. You repeat 10 times. And then the next stretching is to cross the leg at your knee like this, and then you take it towards your chest. Also, you can feel this leg, there's so much stretching around your glute muscles. This is stretching of piriformis syndrome or piriformis modulus. Piriformis modulus is a modulus that entraps your sciatic nerve. Some people are complaining they are having sciatica or they are having problem with that. Actually, because this muscle, it like entrap the sciatic nerve. So when they are in spasm, they will tend to squeeze the sciatic nerve and then leading to problem with the sciatica or refer pain to the lower limbs. So in that case, then you hold it also, you count 10, and then you will bring them back, and then you change the leg. Now you put your right leg on the top, and then you move it towards your chest, and also you count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's good. And then you repeat this also 10 times. The next exercise, in the same position also, you hold it this crook line position, and then you make your hand straight and you tuck in your navel as if you're tucking this, and then you lift your waist. Excellent. This, the best way to do is just make a fist and put it under the back. The height of your fist will be the appropriate height that you need to lift your weights. So it's up to that, then fine. Then you make your hand straight, and then you hold it, you count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you put it back. This is also part of stretching and also part of strengthening exercise of your glute muscles. The next thing is that then you can turn to lie on your stomach. Now you are moving towards strengthening exercise also. In this way, if you want, you can drop the pillow, or if you want, you can be on the pillow. But the best is to remove the pillow so that your spine will be straight. And then you place your hand behind your back, and then you lift your shoulder together with your chest up. And then you go down, and then you repeat it 10 times. Like this, then you move up. This 1, 2, 3, 4, 5. I'm sure you are feeling the muscles. You are contracting the back muscles, which is the low back muscles. So doing this will strengthen the low back muscles. And the next thing is that in the same position, then you make your hand straight by doing alternate movement. You lift your right hand straight, and that's left hand, and then the right leg, and then you put them back, and then the all adjacent one also, your right hand and the left leg straight. No, don't bend them straight, and then you put them back. That's then you count 1. When you do right hand and left leg together, then you put them back, and then right leg and then left hand together. That will be counting as 1. Let's do now. And then put them back, and that's 1. Then this, and then this 2. Also this, you have to do it 10 count. Okay, so then the next, let's move to the mobilization exercise of the spine. In this way, just imagine as if you are doing a horse ride for your small kid. Now you place your hand on the couch, okay, and then place your knees also on the couch, As if you're housing your baby, like this. So now what I want you to do is that adjust a little. Is this one also? Excellent. So now I want to, when you are making arc of your spine, your neck should be looking at your knees, and also you're hunching your back to be up. Yes, you see, you're making an arc that making stretch the back muscles, and at the same time, then you are taking in air to your lungs, and then when you look up, and then you're putting back your low back down, and then you're breathing out. You get it. This is called cat and camel exercise. It's very good for your low back mobilization of the spine. Then you count. Also, you do 10 times. No, don't move your hand. Your hand should be fixed, and then look up, and then you press the back down. That's good. And then make an arc. That's good. And then you take in air, and then when you go down, then you breathe out. That is one of the best mobilization exercises of the spine. Okay, thank you very much. These at least are very good. They are reliable and they are tested. Stretching, mobilization, and stretching exercise for low back pain. Thank you very much.
Welcome back from the short break we took, and I'm sure you guys watched the video, and our listeners also, I'm sure you can comprehend what was going on there, on positions you should, how you should sit, and when you are having those back pains, things you should do and things you should avoid. So back to you, doctor. In situations where someone has intense back pain, and sometimes the pain can be alarming. You don't even know what to do. So what solution, or what first aid do you think people can do at home to, before even getting to a doctor or a therapist?
Actually, what happened, there's some mistakes that some people do, especially in our community. When you have a problem or you have pain, then you try to be your safe doctor or safe.
True. We are all self-doctors in Nigeria.
That's very bad.
Once someone has headache now, they say, take paracetamol, it will stop. We are self-doctors.
Actually, we need to drop that habit. Actually, because some of these symptoms are really alarming.
True.
That's why I was saying about red flags or yellow flags, because you may not know what exactly caused that pain. As I'm saying earlier, low back pain is not a diagnosis, it's a symptom. Meaning that something is wrong with your spine. So at that moment, the best thing to do is immediately see your physician or see your doctor of physiotherapy.
Okay.
At least to address what is exactly wrong. Like for instance now, and then maybe you know a cause.
True.
Maybe you have done some work, or maybe you lifted something, or maybe something hit you that is not that severe. So at that moment, and maybe it's during the night, that you may not be having access to that physiotherapist at the moment or a physician at the moment. So at that moment, then you can improvise some first aid that will help you. Among which is resting.
Okay.
Because mostly when you see there is pain, whenever you see there is pain, then definitely you need to calm the muscles down. Okay. So at that moment, also you can apply some ice. As I said, when you are having acute pain, then you need to use cold.
Okay.
If you remember, I said acute when you are having something pain less than 6 weeks. So at that moment, maybe from the first 24 hours, you can use cold. Cold is very good in suppressing the inflammatory response of the muscles and also the soft tissues around there. So in that moment, I'll demonstrate how you can apply the maybe ice pack or some ice on the back pain. And then after applying the ice, then you can also, if maybe you want to move around or you're having some little improvement, then it's good always to start using belt.
Okay.
Especially if you are maybe traveling or something like that. Don't just go like that with the pain.
Okay.
Try, because mostly when you are, as I said, if you are sitting, you are increasing the tension almost 11 times, the stress. But if you are applying the lumbar corset, that corset will try to relieve the weight of your body up the spine.
Okay.
So that is it. I'll show you how to do that.
Okay. Before we go watch the video, let me just ask you just questions.
Okay.
You made mention of corset, the belt we use. Yes. Are they, can women and outfit and all, there are corsets where women use for, yes, can they use that one as a substitute?
No.
Okay.
Because this is really actually supportive.
Okay.
Supportive in the sense that it has a metallic reinforcement.
Okay.
That will help to lift the weight of your body up the spine. Especially when somebody complains that maybe he's just lifting something and his back and so.
Okay.
Somebody may say maybe in the gym, he's just doing some gym, and then when he lifts it, and then he's a cut or something like that. As I said, the first thing to do is visit your physician.
Okay.
Or visit your physiotherapist.
Okay.
We're going to recommend for maybe a radiological investigation to find what is exactly wrong with you.
What really happened?
Whenever you start having that, then the first thing protects the spine.
Okay.
Don't damage more structure.
Okay.
Then
so using that one can
help to relieve the pressure of the structure.
Okay.
So at least it will facilitate the healing and also relieve you from the pain that you're having.
Okay, so I think we'll allow our viewers to watch the short. Let's go and demonstrate on how you apply the ice on the back whenever you have maybe a severe pain. Maybe it's during the night and you don't have any physician at the moment to help you with everything. So let's demonstrate, and I'm sure our listeners also can comprehend what is going on.
Okay, as I was saying during the instruction session, was when you are having a first aid or when you need first aid for low back pain, is that when patient or somebody, maybe relative, present you with severe back pain and at that moment you cannot meet a physiotherapist at that moment or any doctor, then the best thing is that address the patient to rest, advise him to rest, so that it will be no stressing the muscles that causing the pain again. Like for instance, now I can advise you to lie down on your back. On your back, not stomach, on your back. Lie on your back, and then you bend your knees and rest like this. So mostly when you are presenting with that back pain, by taking this position will relieve the pain. And if still is having the pain, it's not subsiding, then give him some mother relaxant, pain reliever, maybe like any analgesic, NSAID or paracetamol or anything like that. That will help over the counter, that will help to relieve the inflammatory responses. And if still the pain persists or is having, maybe during the night, you want to do more again. And as I said, there is acute pain and there's also chronic. Acute low back pain is that when it is less than 6 weeks, that is acute. And then there's subacute, which is between 6 weeks to 12 weeks. That's subacute. And anything beyond 12 weeks is chronic back pain. So whenever, if you have been having this, it's coming up and off, on and off like this, then you can also get ice. When you get ice, then you crush it. If it's on acute, that the first 24 hours, then you crush the ice. After you crush the ice, then you get towel, soak the towel into water and then squeeze it, so the remaining moist in the towel, and then you apply the ice on that towel. Like for instance, now assume here is our towel. We have it here, and then here is our crushed ice. Then we put it here, and then you fold it, and then you advise. If you can have a ice pack, is the best. But if you can improvise using this one, and then you ask the patient or you ask the relative to lie on your stomach. And here is the region he's having the back pain. Then here apply it for 10 to 15 minutes. Different people, they have different threshold to temperature. So don't leave it for too long. And don't apply the ice directly to the back, but cross it, use towel, and then you apply it for 10 to 15 minutes. Because you can get burned using the ice. Even though it's cold, but can get burned. That's called frostbite. So the first, actually this has like 4 stages. The first stage, you start feeling the cold. Can you feel that? You can feel the cold. And after that, then you start feeling pain, some pain like aching. And then from there, then you start feeling like burning sensation. And then from that burning sensation, the next will be numb. So when you feel numb, then you just notify me. As I said, different people, they have different thresholds. So probably you may reach up to that 15 minutes. Maybe within 10 minutes, you will reach that stage of numbness. Okay. And sometimes, if still using the ice pack does not help, then it's good to relieve the pressure of the back. You can use that using lumbar corset. There's something called a belt that will support the back, called lumbar corset. That will really help to relieve the pressure on the back. And especially some people, they have low back pain and they want to travel. So if you want to travel, then don't travel like that without lumbar corset. Try to get your size and then put it on. So it will try to reduce so much significant weight of your spine up the affected region. So this is part of the few first aid of low back pain before you meet your physiotherapist. Thank you very much.
Okay, welcome back, and I'm sure that was quite educative. At least you'll be able to like do something at home when something like this happens or occurs at home. So what advice would you give our listeners and viewers?
Basically, we can reduce the burden of low back pain by understanding what are the causes of low back pain. When we understand the causes of low back pain, then we have
You
so
try
much
to like avoid all of those
to avoid
things.
all that, and then to improve our quality of life.
Okay.
So now I would advise that actually we should be encourage more of doing exercises, more of activities of daily living, sports, and other things like that. And quit smoking. If you're smoking, I'm sorry to say, but try to quit. It's one of the very bad risk factor of the low back pain.
Okay. Which brings us to the end of today's episode on Health is Wealth. You can follow us on our social media platform. On Facebook is at Official BUK TV. On Instagram is at Official BUK TV. On Thread is at Official BUK TV. On X is at TV_BUK. On TikTok is at BUK Television. On YouTube is at BUK TV Radio. And on Telegram is at BUK Television. Keep watching Health is Wealth on BUK TV. My name is Fatima Rufai Musa, and I remain your host. Bye.